I will explain the symptoms, causes, and effects of type 1 diabetes. I will inform you the effect that it can take on young children and young adults. So let's get started. Numbness, tingliness in the hands and feet, blurred vision, increased hunger, increased urination and thirst, fatigue, unexpected weight loss, and sores that do not heal. Now, if you guessed correctly, which you should have, these are all symptoms of type 1 diabetes. These symptoms can occur within the matter of weeks compared to type 2 diabetes. Type 2 diabetes is often developed more slowly within the matter of months. Now, type 1 diabetes is a serious disease that affects many children and many adults around the world. The disease causes the pancreas to stop producing insulin, a hormone that regulates blood sugar levels in the body. When the blood sugar levels are too high, the smallest vessels in the body eventually become damaged. This can lead to serious health conditions further down the line that include heart attacks, stroke, kidney disease, blindness, and also amputations in the arms and legs. Now, only 5% in the entire world have been diagnosed with type 1 diabetes. 5% of young adults and young children. Now, that may seem like a very low percentage, but compared to the entire world, that's more than 1,000 children. That's more than 10,000 children that have been diagnosed with type 1 diabetes and have to go through that. Now, men and women are equally getting type 1 diabetes or being diagnosed with type 1 diabetes. You are at risk for type 1 diabetes if you are the age of 20 and younger, if you have a parent or a sibling that already has type 1 diabetes, and if you are Caucasian. Now, a fun fact that is not really fun, dead in the bed syndrome. Now, dead in the bed syndrome is a term used to describe the sudden, unexplained deaths of young people with type 1 diabetes. The syndrome is characterized as when someone with insulin-dependent diabetes has gone to bed seemingly perfectly fine, that has had no issues with their diabetes, blood sugar levels were perfectly fine, and the next morning they ended up dead. During the years of 1988 and 1990, in Bergen, Norway, 4 cases of unexpected deaths in young type 1 diabetic patients happened. Perfectly normal. Professor R.B. Tattersall from British Diabetic Association in London observed 22 similar cases in Great Britain during 1989. The British patients were between the ages of 12 and 43 years old. Most of them had gone to bed in apparently good health and were found dead the next morning. Of the 22 patients, 19 were sleeping alone at the time of the death, and 20 were found lying in an undisturbed bed. That is extremely mind-blowing. Now, today, researchers have found that they believe it was a cardiac situation, that it has something to do with the heart. Now, they're not 100% sure. This research is still going on, but there is legit no cause or no explained reason as to why these patients have died who have been diagnosed and have been living with type 1 diabetes. Now, it's very, very rare, but it does happen to people who have, or young children who have type 1 diabetes. Now, I have interviewed a young girl. Her name is Carmen Maria Mango, and she has been diagnosed with type 1 diabetes on June 27th of 2012. She was only 4 years old at the time, and now she is a 12-year-old preteen brat who is also my sister that I love oh so dearly. So the first question that I asked her was, how does it feel to have type 1 diabetes at such a young age? Now, she was very blunt, and she did not sugarcoat anything. Her response was that it sucks, and it's a burden. The second question that I asked her was, What are your difficulties and your challenges having type 1 diabetes? Now, Carmen's response was maintaining her blood sugar levels and always having to watch what she eats, always having to visit the doctor's office, and having to go to therapy about it. And sometimes she feels like, it's just a lot of weight on her shoulders. And she also said that sometimes that she wishes she didn't have type 1 diabetes. Now, the third question that I asked her was, how does this affect your everyday life? Carmen's response was, people always ask questions, and that can be very overwhelming, which I understand at being a 12-year-old. And when her blood sugar gets too low or too high, she has headaches and she has no energy to play with her friends or to go outside. And the last question that I asked Carmen was, what inspiring words can you share with other young children or other young adults that have been suffering with type 1 diabetes? Her response was, keeping your head up and always stay positive and always stay strong. And always, always, always have someone in your corner that you can always talk to, because it's good to talk to somebody about these things, which I totally would have to agree with her. It is good to talk to somebody about these things, about type 1 diabetes, if you are suffering from type 1 diabetes at such a young age. As you know, having type 1 diabetes at such a young age is not an easy thing to deal with. I literally commend Carmen for being able to answer these questions truthfully and honestly, and I'm glad that she was able to answer these questions. Every day there are highs and lows, multiple injections or a constant drip of an insulin pump. Every day there are health issues to deal with. Every day this disease has to be managed. It cannot be controlled. It may be silent to you, but type 1 diabetics fight every day, and all you usually see is their smile. If you know one, you know a hero.